Okay, so what we're going to focus on today is neonatal care, basically taking care of the newborns, the baby goats or kids and the lambs. Different places define it differently as far as up to what age. I'm going to say basically we're going to talk about them from day 0 to day 14. So the first 2 weeks of their life. Once again, if my volume suffers, if it gets low, please let me know in the chat box, because as you know from previous sessions, sometimes that happens to me. So we're going to talk about the babies. This is obviously is a newborn lamb. Again, the PowerPoint presentation is already on SlideShare, and you see the URL on the slide. The whole goal of raising sheep and goats in most cases is to produce healthy live babies and to lose as few as possible. And the number that you lose does vary. If you're a small flock, you could conceivably have a year where you don't lose any babies. A lot of times they'll give percentages. Well, you shouldn't lose more than 5%. Well, on a big flock, if you have like 1,000, that 5% makes sense. On a small flock, it's sometimes it's hard because a lot of random things can happen. But I think you definitely want to keep below 10%. Myself, ideally below 5%. And there's a lot of different things that's going to affect whether that baby's going to survive. And there's two primarily, the baby himself, characteristics of the lamb or kid himself that are going to affect his viability, as well as things about the female, about the doe or ewe. So when we talk about the baby himself, the number one factor that determines whether that lamb or kid is going to survive, when they do these big statistical analysis, is the birth weight. And we've talked about that, I believe, in the first session. We don't want big babies. We don't want little babies. We want moderate-sized babies. And how big the baby should be depends on the species. Obviously, sheep or lambs tend to be bigger than kids. And then there's tremendous breed differences within the species. A Suffolk lambs are going to be bigger than Katahdin lambs, which are going to be bigger than Icelandic lambs. Even within goats, you're going to see breed difference. Nigerian dwarfs, Nubians, there's going to be differences. But generally speaking, all other things equal, moderate-sized babies have the strongest livability. The sex of the baby, although there's kind of disagreement on that, usually the female babies are stronger. I don't think it's a big difference. Obviously, when we have an animal that gives birth to multiples, birth type is going to have an effect on viability. A medium-sized single that had no trouble delivering is going to have a very high livability. Same with twins. As the litter size starts to get larger, and in many cases the babies get smaller, we're going to have a reduced livability. When I was in graduate school, I studied lambing rate, the number of babies. And there was the more babies a female had, the lower percent lived. How the baby behaves, its behavior, and a lot of that gets back to what we were talking to a little bit before we started. The vigor of that baby. Once that baby's born, you want to see him up in just a few minutes, within 15 minutes. You want to see him standing up. You want to see him you want to see him nursing before he's a half hour or 30 minutes old. And there are differences within individuals, and there certainly are differences within breeds. And the mom can do a lot to influence this. I really like the ewes that push their babies to get up. Occasionally I'll have one that'll be a little vicious. I mean, she'll really whack them to get up. But mom is supposed to encourage them. And then there's a lot of factors that have to do with the mom. We have a question about the prolific breeds like the Finn sheep. Yeah, I think a lot of these, when we look at the three things affecting that the offspring determine, within that breed, within the Finn breed, within the Dorset breed, those things are going to influence the viability of those offspring. We know Finn sheep babies are smaller, so it's within breed, but they're tough little guys. They really have a strong survivability. And more research is looking at these type of fitness traits in sheep. I'll give you a perfect example. I grew up raising Southdown sheep as a kid. That was one of the breeds we showed. And they fell out of favor a long time ago other than as a show breed. Well, the research community is rediscovering that breed, and there's several universities that are doing research with them, primarily with the ram, and their hypothesis is that these little Southdown crossbred lambs are just have a stronger survivability than some of our traditional terminal sire breeds. The research will tell us, but that's their hypothesis. Now, the things that affect from the dam standpoint, and I find this really interesting, is the number 2 factor is, and this was based on an extensive study done in the United Kingdom, was body condition score. So a real thin ewe or doe, her babies are less likely to live. Okay? Does that mean every thin female is not going to raise good babies? That doesn't mean that, but statistically speaking, body condition score is really important. Also related to nutrition, just like birth weight. Parity meaning, is it her first litter? Is it her second litter? Obviously, a 2- and 3-year-old female is a better mom than a yearling, and she produces more milk. Maternal behavior, is she a good mom? Obviously, if she ignores her babies or just doesn't do a good job, that's going to affect their livability. Maternal behavior, there's differences within breeds, within lines, and certainly between breeds. That's a trait that I know is really important to me. They've tried to quantify it from a research standpoint and haven't been very successful. The third factor is the colostrum. She can be the best mom in the world and he can be the right size babies, but if there's not enough colostrum accumulated in that udder and they don't get enough colostrum, that's going to affect their livability. So those are the really big factors that affect livability. And of course there's a lot of other things that are going to factor into survival. A lot of environmental things. When and where you lamb or kid. Generally speaking, if you lamb or kid in a building, you tend to have a higher survival rate because you're not having to deal with bad weather. Like take right now when it's so bitter cold. If they all have, there's some people that keep them outside. That's going to affect livability. Even as we move into the milder months, March and April, you can still have some pretty vicious storms. So those are going to have impacts on survivability. And then you can even, to me, throw in predators. If I lamb out on pasture or kid out on pasture, the predator risks tends to be higher than if I've got them in a more confined situation. How we manage them, nutrition, that relates back to several of the things in the last slide. Nutrition is just so important, and it affects a lot of these other things that we're talking about. That last third of pregnancy, our first session, so very important. Ease of birth, even if you didn't assist the delivery of the babies, but they had a long, hard delivery, that can certainly affect their livability. It can do it in 2 ways. One, they're not going to be as vigorous. And 2, mom might be wore out. She might be stressed. Sanitation. Sanitation has a lot more to do with after the babies hit the ground and start experiencing their surroundings. But the 2 major disease problems that we have or one of the major disease problems that we have, scours, is largely a sanitation issue. Crowding relates to sanitation, but can relate to a lot of different things. And then genetics, within breed differences, between breeds, within breeds, certainly certain sires hire larger babies that could cause some lambing or kidding problems. A lot of these factors are all intertwined, and it's hard really just to separate one. But again, the birth weight is important. Worldwide, I suspect the birth weight problem is more light birth weight, not big ones. In small flocks, I think we probably can get into big babies because we tend to feed them a lot better. Same thing with body condition score. I think on large flocks, that's going to tend to be a bigger issue. On small flocks, we have a lot of overfeeding. Okay, so a lot of it depends on the size of the flock and the type of management system. We're going to have bigger babies, fatter sheep and goats with grain feeding. Pasture operations are going to be different. So just a lot of different variables. I thought it might be interesting to look at when most lambs and kids tend to die of the ones that we lose. And I couldn't find any data on goats for when death losses occur, but this shows you when death losses occur for lambs. And about 2/3 kind of occurred at day 0. They died, in this case, they died either before, during, or shortly after birth. And then another 18% died the first 8 days of life. So most of the losses are occurring within the first week, which tells you if you got X amount of days off from work, those are the days that you can make the best use of your labor to be there when they're born, when they're the first week. This is another survey for the sheep industry as a whole in the U.S., and it separates deaths within the first 24 hours, the first week, and then between a week and weaning, and it looks at it from different size operations. And there's certainly some differences, but not necessarily huge differences. Again, it's kind of the majority of deaths are still occurring in that first week of life, so that's when they're the most fragile. And then the other thing, some statistics on what causes the babies to die. This is a well-known study at the U.S. Sheep Experiment Station in Idaho. These are range sheep, but they do shed lamb them. And they found almost half of the lambs that died, neonatal lambs, died from scours, from diarrhea. Another 20% died from starvation and about 8% from pneumonia. We're going to talk about each of these 3 things because they're major causes of death among these young lambs and kids. This is some data from the Dairy Sheep Research Farm in Wisconsin. Ironically, I'll be there on Sunday. What's interesting about this one is it's the death loss between 1 and 7 days of age. And you've got starvation, pneumonia, and things like that, but ones that are sort of interesting is you got the largest figures on ewes laying on their lambs. That's a management thing. And then you've got another 5 that died accidentally. If I had these statistics on my farm or these things happening on my farm, I'd feel good in the sense that maybe I could control these a little bit better because should be easier to control from a management standpoint. I did come across some data on some goats. This was in Jordan in the Middle East, but goats are very big in that part of the world. And basically the same thing that we saw in the sheep statistics from Idaho, diarrhea and pneumonia. There's lots of different ways, lots of different combinations of things here, but the primary causes of death were diarrhea and pneumonia on kids. Actually, this is kids and lambs. Kids and lambs. So just thought I'd do us a little, be interesting to look at when some statistics are looked at, when some surveying is done, what's actually causing the death of lambs and kids during these early times. We don't always know, but sometimes we do. We talked about the aftercare of after lambing and kidding the last session, but just kind of a little reminder. There's this old saying to help people remember what you need to do: clip, dip, strip, and sip. And the whole idea is that after the babies are born and the mom's had a chance to lick them off and things like that, you should clip the navel cord if it's really long. Say it's 3 inches long, you should clip it to about 1 inch. You should dip the navel cord in gentle iodine, chlorhexidine, or betadine. I myself use betadine. I put it in a little container and push it up against the baby to make sure I get complete coverage. I think dipping the navel cord is extremely important if you lamb inside. Extremely important if the conditions aren't as clean and dry as you would like them to be, which unfortunately, no matter what we do, is very often the case. This is something easy to do that can protect that baby to keep infection out. The navel cord is a primary place for infection to enter, to get into the baby. Plastic film containers are also great for navels. The teat dipping cups for dairy, to dip the teat of a dairy cow, also work well. Anything you can kind of put that little navel cord in and completely submerge. Okay, so that's clip, dip. Strip means simply to pull down on the teats. You're going to remove the wax plugs and open the teats up so that it's easier for the babies to nurse. It's a good way for you to check the milk supply to make sure, one, she has milk coming out, and secondly, it'll give you an idea of the supply of milk that she has. And then the sit part is simply to make sure the lambs and kids nurse and get the colostrum. It doesn't mean you need to get down there and make them nurse. There's going to be some situations where you may have to, but in the vast majority of cases, it's just the idea of you want to make sure they're nursing. You want to observe them. They'll wiggle their tails when they're nursing. Some may need help, a little one or multiples or something like that, but you just want to make sure they're nursing, that they get their sip of colostrum. Speaking of colostrum, this was the third other important factor that determines the survivability of neonatal lambs and kids. Who needs colostrum? All mammals need colostrum. Question about the time frame for milk being there. Most cases it's there immediately. Most cases. Sometimes there's a delay in milk letdown. Sometimes I've noticed that yearlings will have milk, but more milk will come in a day or two. Some people will resort to giving oxytocin to try to help with milk letdown. That's one of the rationales for letting the female eat her placenta, because there's hormones in there that are supposed to help with milk letdown and returning the uterus to normal. But it should come down immediately, but sometimes it doesn't, and there's various reasons why it might not. The most important thing to be concerned about is that you don't have any disease issues such as mastitis, OPP, CAE, that sort of thing. And if it doesn't come down soon enough, you're going to have to give them an alternate supply of colostrum until it does. And then if it doesn't at all, obviously you're going to have to artificially raise them or foster them onto another female. So the colostrum is the first milk that the female produces. Basically in sheep and goats, it's only for the first 24 hours. It's not for a week. It's not for 3 days. It's for 24 hours. It's very nutritious, energy, protein, vitamins, and minerals, particularly vitamin A, vitamin E, iron are its first sources. It has laxative qualities to help with eliminating the feces early on. And then most importantly, it has maternal antibodies. Those antibodies are large protein molecules that the baby can only absorb for the first 24 to 36 hours after birth. After that, he can't. And it's most efficient the first few hours after birth. So ideally, you want the babies to get up and nursing within that first, obviously we all think the first 30 minutes, but I'm going to say the first 2 hours. But they do consume colostrum that first 24, but this is the case of the sooner the better for everything. The baby needs to consume about 10% of its body weight in colostrum. It's hard for us to know that, because if she's nursing the babies, we're not going to be able to measure that. We're just going to be able to see how the babies are doing. If we have to artificially provide colostrum, tube feed it, obviously we can make sure that they get that quantity. Now, people always ask about colostrum sources because, as Linda just asked about having a ewe maybe that didn't let her milk down, well, gosh, she doesn't let it down at all. Well, what do we do? Where can we find an alternate source of colostrum? Well, in some cases, you might just have a weak baby, and you can get colostrum from its mom to give it. Obviously, that's the best source. The next best source is going to be colostrum from another female in the flock or herd. And the way you get that is, say you have a female that has a single, and she's got plenty of milk for that single. We'll milk her out and save some colostrum. Works real good to put them in like an ice cube tray, and then you can put them in plastic bags. Maybe you have a female that unfortunately lost her babies. We'll make sure you get her colostrum. If you have to thaw it, which very frequently we do, either because you because you prepared and you had it ahead of time, you just need to make sure you do that very slowly. Usually a room temperature thaw is best, or a hot water bath. If you microwave it, you want to do it on very low. You don't want to do it fast because your chance affecting the antibodies. Okay, you don't have any from your own farm. The next best source would be colostrum from somebody else's farm. You or doe colostrum from someone else's farm. The risk you have here is disease risk because we do pass things through the colostrum. CAE and OPP do cross-transmit. CAE is caprine arthritic encephalitis. OPP is ovine progressive pneumonia. They're very similar diseases. They're both slow viruses. There's no cure for them. They're primarily passed in the milk. So if the place that you get the colostrum from has that disease or doesn't know, ideally you should pasteurize it. There's also a risk of yonis. Cow colostrum, kind of similar to the ewe and doe colostrum from another farm. You do need to concern about the disease, in particular yonis disease. So again, if the herd's not yonis free, you would want to make sure you pasteurize it. The problem with cow's milk is simply, at least from the sheep standpoint, is it's much lower in fat than ewe's milk. So you really kind of need to feed more of it. Where we say 10% of body weight, you're probably going to need more of it. It would be better to get cow colostrum from color breeds like Jersey because they're going to be higher in fat. I have used cow colostrum before myself. What about all that stuff you can buy that says colostrum substitute or colostrum powder? There are some products out there that I've seen at least one for calves that claim that has antibodies in it. I suspect antibodies for something like E. coli. It's not been tested on lambs, and again, it's a new calf product. More than likely, what we see instead is colostrum supplements, and these are very nutritious products, but they don't have any antibodies in them. The way I look at it is they're better than nothing because nutrition is an important part of what colostrum provides to the baby, but they're not going to get the antibodies. Same thing with homemade colostrums. You can find recipes for homemade colostrums that are, again, they're providing nutrition but no antibodies. Antibodies is one of the important things that we get from colostrum that we just can't readily get using a commercial product. But if you have a set of lambs or kids and you've got no source of real colostrum, by all means you want to use these supplements. By all means. But realize that they're not going to give the passive immunity that a baby would have gotten if it had nursed its mom, both for kind of the bacteria and bugs on your own farm, but for anything you might have vaccinated for. So very often we would initiate vaccination earlier if they didn't get colostrum. And then once the baby's 24 hours old, you can feed the lamb or kid milk replacer. In fact, if you've got one that you have to supplement, there's no point in giving them colostrum once they're 24 hours old. Bill Duffield mentions that he has an Utterly Easy, which is a piece of equipment for making it easier to milk a sheep, a goat. They were originally actually developed for horses. So that's be a great way to get colostrum. I'd probably just, if I was milking you to get colostrum, again, it's basically 24 hours, so once that passes, I wouldn't get any more colostrum. I wouldn't expect that to be colostrum anymore. And the best would still be early on. There's a significant difference in the amount and quality of colostrum that a female produces. In actuality, if you have a choice of whose colostrum to save, it would be a mature female. It would be a mature female, not a young female. How long is frozen colostrum good for? I actually don't know the answer to that question. I really don't. I guess if I had some in the freezer and I had somebody who needed it, I'd look at it as a better than nothing. But I actually don't know the answer to that question. If anyone else does, certainly feel free to provide that input. So going back to some of those original studies looking at the causes of death, we're going to look at what I consider to be four main ones, and then a fifth one that I don't know how numerous it is, but I know it's a problem. So we're going to look at hypothermia, starvation, scours, pneumonia, and floppy kid syndrome. The first one we're going to talk a little bit about is hypothermia, and this is certainly something that is relevant right now with a lot of us experiencing some pretty cold temperatures, and then if you combine that with wind and dampness, it can even be worse. Okay, so we have a lot of problems with young lambs and young kids being very vulnerable to the cold. They're losing body heat and they're not able to produce it. They can't regulate their temperature themselves in the first 36 hours of their life. The only thing that's going to help them generate heat is energy. But if they're too cold to eat, too weak to eat, you know, we gotta take care of the hypothermia first. And very often you can tell, you know, without taking the temperature, but it's best if you take the temperature. Normal is about 102 to 103 degrees. Goats maybe just a tad bit higher, but basically that's normal. If they're below that temperature, down to about 98, they're mildly hypothermic. Less than 98, they're very severely hypothermic. Obviously, the babies need warmed and fed, but in many cases, you have to say, well, how serious is the hypothermia, and can the baby swallow? If it's just mildly hypothermic, you can warm the baby and tube feed it warm colostrum, and it's amazing how quickly they will respond if they're mildly hypothermic. Okay, good comment by Roy and Robin. The antibodies in the colostrum would be quite stable, so if you don't freeze it and thaw it, it sounds like you'll be in pretty good shape. When we get these severely hypothermic babies, they tend to be hypoglycemic too. So they need, and you shouldn't tube feed them, they can't nurse, so you need to get glucose into them. And that needs to be the first thing that you do. And then you warm them, and then you tube feed them colostrum. A lot of different ways to warm the babies. Dry heat is best. Putting a hairdryer, a warming box, blankets, heating pads, things like that. Don't put them in the oven. I'm not a big fan of heat lamps. That's probably the least effective way to warm them. The old-time way, and I'm sure still done a lot, is to immerse them in warm water. Obviously, you wouldn't put their head in warm water. You kind of put them in a bag and put them in warm water. Question about the ideal or normal temperature for the newborn. Again, it's 102 to 103 degrees is the normal temperature of a sheep and goat. We're going to talk about how to get the colostrum and glucose in them after we go through these couple of slides on hypothermia and starvation. Starvation is another common cause of death, very often tightly related to hypothermia, particularly in winter lambing and even early spring lambing. Lots of causes for starvation. She doesn't have enough colostrum. She rejects the baby. She's got mastitis. One of the problems my dad had with his goats years ago was they were Nubian boar crosses, and the older they got, their teats were very large, and they didn't have great support of their udder like a lot of dairy goats, and so they started to hang down real close to the ground. And sometimes those kids needed a little bit of help to nurse for the first time. They were just so low to the ground. Just lots of different things can cause a starvation problem. Picture the little red lamb that you see on the slide was actually one I had a couple years ago. Its basic problem was it couldn't compete with its other siblings, and the mom had sort of given up on it. You can tell when a baby's starving, and of course starvation doesn't just occur at day 1, day 2, day 3. It can keep being a problem as we go farther along. They're very lethargic, keep their head down, they're weak. If you pick them up, you can see that they have an empty stomach, and very often they're hypothermic. What you give them, obviously they need food, a glucose injection if they're weak and can't swallow, tube feeding them colostrum. If they're over 24 hours of age, obviously you don't need colostrum anymore. You can tube or bottle feed that. And ultimately you may need to artificially raise one if the mom's not producing enough milk for it. Tube feeding. This is probably one of the most important things that everyone needs to know how to do if they raise sheep or goats, and be comfortable doing it. There's at the bottom of this slide, there's a URL of a really nice fact sheet on tubing lambs and kids. It's written by she's actually a 4-H agent and veterinarian at Washington State University, Susan Kerr. It's a very nice fact sheet. Takes you step by step how to do it, tells you even what happens, how to tell if you've gone into the lungs instead of the esophagus. But here's just some general tips. We're going to get to the glucose injection after tubing. First thing is to be clean. Use clean equipment. Always wash it. Warm soapy water. Make sure the equipment is clean. Before you even tube the lamb, or kid, you want to see how far you need to put the tube in. Because basically the equipment you need is a 60 cc syringe and then a kind of a long flexible catheter. So you want to kind of put that up against the baby to see how far you have to go in. Because obviously you could have a very little baby, you could have a very big baby. Just like in this picture, it's best to hold the baby between your knees in the upright position with its head in a normal position. You don't want to lay it down prone. You want to have it like this. Maybe sit on a bale of straw. Before you put the tube in, you can dip it in clean water. Let's see, somebody says the full screen button is covering the URL on my screen. Does that help? Otherwise, I don't know what else to do. I'll have to write it in the chat box. Oh, that worked. What I typically do before I insert it is I usually dip it in some milk. And I think Bill mentioned he put KY jelly on the tube for easy entrance. This is something that you do. Obviously, you're dealing with a delicate baby, and it's gentle. You go in the side of the mouth, and you very gently push it back towards the back. It should swallow as you push that tube. It should swallow, and you should be able to tell. And that doesn't mean he still can't go bah or cry or indicate to some extent that he's really not happy with what you're doing. I mean, some of them, it's amazing how easy it is, and some of them will resist quite a bit. And not because you got it in the wrong hole, but just because they're pretty strong. And I remember one time I had a C-section done on a ewe, and she was still asleep, and the babies were hungry, and they were very, very vigorous. I was able to tube them several times, but they were just bouncing. They said, we don't want to be tubed. But they had to be, and they just, maybe I'm going to say to some degree, fought it a little bit. You should be able to feel the tube on the left side of the animal's neck, because obviously your biggest concern, and especially when you've never done it before, is, well, I want to make sure I don't put the tube down the wrong hole, down the trachea, get the milk into the lungs, because that would kill it. That would kill it. So you should be able to feel the tube on the left side of the neck. One of the tips that Dr. Kerr gives in her fact sheet is how to tell if you're in the right hole. And what she does is she says after you put the tube in, then she puts the syringe, connects the syringe with the plunger, and she pulls back on the plunger. If you're able to pull back very far, you're in the wrong hole. If you're in the esophagus, you shouldn't be able to pull back, but maybe a very teeny amount. Question about if the baby can't swallow, do not tube it. That's where the glucose injection comes into play. This basically, you tube a baby that can swallow and can hold its head up. Can swallow and hold its head up. In some cases, although I prefer to tube, if the baby will take a bottle, you can do that too. I prefer to tube because I don't want the baby to like the bottle. I want the baby to go back to the mom. Once you've got the tube in there and you've got the syringe on there, you take the plunger out. You're not going to force milk down with the plunger. You fill the syringe up with warm milk. Let it fill via gravity. Again, you're not going to push it push it down. The size of the catheter, I'm trying to look at my fingers thinking it's probably 8. They're small, and they do come into different sizes, but it's like 8 millimeters, I'm thinking. And they usually sell them as a lamb saver or lamb reviver or kid saver or kid reviver. They often come, you can buy the pieces separately, but it's a now I lost my train of thought, but it's a 60 cc syringe, and it has a certain ending, not that you put a needle on it, but so you can put the catheter on. And they come clear. They come like you see in that picture. It's kind of an orange color, and some are more flexible than others. And one thing that was mentioned, I think, already in the chat box, but when you're finished and you're pulling the tube back out, it's good to squeeze that end of the tube so that as you pull it out, you don't have, as you're pulling it up through, you're not having milk still dripping out. And when you're when you're tube feeding, it's better to feed them frequently, 2 or 3 ounces a time, and do it frequently as opposed to putting an awful lot of milk in them. And this is particularly true with really small babies. 2 to 3 ounces can be an awful lot of milk for very small birth weight babies. So about 2 to 3 at a time. And I'm thinking that I don't remember my metric conversions properly, but I'm thinking 60 cc's is not quite 2 ounces. If the baby cannot hold its head up, cannot swallow, you should give it an injection of glucose. It's usually a 20% dextrose solution. And this is a picture, this is actually the author of that 30 cc's equals 1 ounce, so that 60 cc's is actually that 2 ounce. Here we have Anita from Virginia listens to her lambs with a stethoscope. You can hear air in their belly if you inject air. So that's another way to do it. I've tubed hundreds and hundreds of lambs my whole life, and I've never had a problem with them. Because if you go down the wrong hole, the baby's going to fight it. You should be able to tell you that you're in the wrong place. Obviously, if you do one that can't swallow and hold its head up, you're not going to know, but you shouldn't be tubing that kind of baby. If that baby is really weak and can't swallow and can't hold its head up, you need to do the methods you see here in this slide. This was the author of that fact sheet on tubing, Dr. Susan Kerr. She did our lambing and kidding school for us 2 years ago, and we're hoping to have her back this year, and she demonstrated this. I realize this isn't a live lamb, but it would work the same. You hold the lamb up by its front legs. You use a 1-inch 20-gauge needle. You go through the body wall, about 1 inch to the side of the navel, and point towards the tail, and you slowly inject the solution into the body cavity. How much you would give I suspect would depend on the size of the baby. And I look at this situation pretty much as I look at tubing. If you have a baby that needs it, don't be frightened about giving it, because chances are he's going to die otherwise, and if you give it, you have the best chance of saving his life because you're getting that glucose into him. Same thing with tubing. If a lamb truly needs tubing, then you need to do it. And as far as does the fluid need to be warm before the IP injection, that's an excellent question. I guess I'm not sure. I guess my gut would say I probably would make sense. I guess I just don't know factually if you need to do that. All the years I've raised sheep and goats, I've only done this, felt the need to do it once. But again, it's really important that you not tube a comatose baby. They've got to be able to swallow and hold their head up. And then the other thing is, again, the idea about getting it in the wrong hole. A baby that can swallow, that has some vigor to him, he's going to let you know when you're doing the wrong thing. He's going to let you know when you're doing the wrong thing. Okay, let's talk about the other couple of questions. How far does the needle go in for this? Let's look. I believe you can tell from this picture she's gone all the way in. So it's a 1-inch needle, a 1-inch needle. And caudal is to the, I guess, to the anterior of the lamb. Okay, other two big problems that kill lambs and kids are scours and pneumonia. Scours is something that's got lots of causes, lots of contributing factors. We've got environmental, simply unsanitary conditions that allow the disease organisms to spread. The most common bacterial cause of scours is E. coli, which they commonly call watery mouth because they get a watery mouth. Salmonella can be a cause, Cryptosporia, Giardia. Clostridium perfringens type C. We talked about vaccinating for C, D, and T. This is the C. This is the overeating type C, and it causes scours. It causes enteritis. This can be a cause of death. Okay, and then you can even have some viral causes. The babies look gaunt and depressed. Obviously, I'm not saying this kid in here has scours, but it was the only dirty rear end of a goat that I could find as a baby. But you're going to see, it's obvious what scours is. It's liquidy feces that very much is stuck to their back end and down their legs. And they're going to become dehydrated. In fact, that's the number one problem with scours is the dehydration that it causes. The pictures in here are from the UK of what the E. coli scours, the watery mouth. That's what the picture of this lamb is. Because of the dehydration, you need to get fluids into them, oral electrolytes. If it's a bacterial cause of diarrhea, we typically give antibiotics. The antibiotic of choice is called spectinomycin. It's not, in the U.S., it's not approved for sheep and goats. That's why we have the little RX there. It's by prescription. Goes by a lot of different names. It's commonly marketed for baby pigs, for E. coli scours. It's this little orange medicine with a little pump on it. Sometimes they call it pig pump, but you squirt it in their mouth. Ideally, you don't have to deal with scours. Ideally, you're able to prevent it. And the way that you prevent it is, again, that colostrum is key. And one of the antibodies they're getting for that is for things like E. coli. And that's why the commercial colostrum substitute that's on the market for calves, that's primarily what you're looking at immunity on, is things like E. coli. Good sanitation, because again, with poor sanitation, the diseases spread. Okay? And then if the cause is type C overeating disease, obviously vaccinating the dam prior to kidding and lambing is going to help with that. And in this case, more than likely, you're going to have type C diagnosed through a veterinary lab to know actually what it is. Your most likely cause of a lot of diarrhea and death losses in baby lambs and kids is E. coli scours. The other ones would be the exception where that you might get diagnosed. And you're thinking, well, what about coccidia? Coccidia tends to affect them as they get older. When they're very young like this, E. coli is the common cause, and poor sanitation and these things just kind of contribute to the problem. And obviously, like most things, if you catch it early, you stand the best chance of success. There used to be a product on the market, and it may still be there, where you could give baby lambs oral E. coli antibody. But I've not seen where that's available on the market anymore. I think it's called E. colizer or something like that. And I know it's available for calves. But I look at if you had a lot of scours and you were losing a lot of babies, while you certainly want to use products to get you out of the hole right now, this is a management thing that you got to figure out why it's occurring. Bacterial pneumonia, another common cause that these lambs and kids die. It's primarily caused by usually by Pasteurella. PI3, parainfluenza virus, is another one that tends just to make them more susceptible to Pasteurella. But there's actually a cattle vaccine for PI3 that's given intranasally that some sheep producers have given. Of course, like pneumonia in any animal, the primary symptom is an elevated body temperature. Again, normal is 102 to 103. Labored breathing, they're going to be depressed, hang their head down, droopy ears, kind of the normal I don't feel good kind of thing. So the main symptom, though, is going to be that higher body temperature. Because it's a bacteria, antibiotics are the course of treatment. You'll notice that every single one of them is prescription. I'm thinking Nuflor may possibly be approved for sheep, but these are suggested antibiotics for pneumonia, the antibiotics of choice. You notice the last one should not be given to goats. And obviously if you work through a veterinarian like you're supposed to, they would know that as well, but these are just some of the ones that you give. Just as an example, we have a protocol with our goat test, and the drug that we use for any respiratory problems is XNL, that we're able to use extra label on respiratory problems. Someone's heard that oxytetracycline depresses bone development. Well, it's not like we're feeding it or giving a lot of it. If we had a baby or even an adult that needed treated to save their life, that's going to trump any possibility of depressed bone development, although I don't have any specific knowledge of that myself. About the Mocotil, I think it can cause death in humans if accidentally injected, and from what I read, it can cause severe reactions in goats, but can be used on sheep. I would probably, what we're more than likely, most of us, legal or not, tend to have LA200 on hand, which is oxytetracycline. I know a lot of other folks that work with their veterinarian may have either XNL or Nuflor as well, and those are going to be the primary ones. Or you have penicillin on hand, so probably not even going to use that other one. Again, I see this as a management issue. One of the primary causes of pneumonia, even though it's environmental, is poor ventilation. So again, pneumonias, bacteria are opportunistic, and so when you have poor ventilation is kind of airflow. Graftiness is, I guess they have some similarity. When something is if there's a draft, obviously there's wind coming in, excess. Whereas, and then ventilation, we still want fresh air. We just don't want it wind, drafts. We don't want wind and drafts. If you put I believe Bill Duffield mentioned this in an earlier session, if you get down to the level of the babies and you smell ammonia, you've got problems. So you need ventilation, you need open ventilation, but you don't need drafts and you don't need wetness. Remember, cold is okay. It's the drafts and the dampness that can cause problems. And we have a tendency, and particularly I'm going to say as you go into the more northern climates, to close things up too tight because it's comfortable for us. It's comfortable for us. And I realize that we build buildings for us as well as the animals, but usually natural ventilation and having some openness in that system is going to help. But at the same time, we don't want it really drafty and again, damp and that sort of thing. Getting back to colostrum, again, can't overemphasize colostrum. We got to feed the ewe so that she produces good quality colostrum, ample quantity of colostrum, and that the babies consume adequate quantity. And that's going to help everything that gets thrown at this kid. So if a kid doesn't get the colostrum, or maybe he got a supplement, it doesn't mean he's going to die if he's exposed to these bugs, but he's going to be at greater risk. Because babies can live without colostrum. I've raised them before where they only got colostrum supplement because I didn't have anything else. But you just simply need to understand that their immunity is compromised. And hopefully they're in a good enough environment where they can get through, they get exposed to these things, but they survive. But adequate colostrum intake, again, is the key. Getting it produced, getting it consumed. Beyond that, there's no reason to do anything extra, as far as I'm concerned. If the ewes got adequate colostrum and the babies are drinking the colostrum, I don't see any reason to tube them. I don't see any reason to give them a supplement. If nature is working, let it work. Only intervene when there's a problem. And of course, getting back to the type C overeating, if that is diagnosed, that obviously you want to vaccinate for it. Okay, floppy kid syndrome, something very specific to goat kids. Question for pneumonia in a newborn. I would say antibiotics would be the same thing. Floppy kid syndrome is kind of a really fascinating disease. It's not known to occur in lambs, and I don't know that it occurs in alpacas or anything like that. It's largely unknown actually what causes it, but basically they think it's a metabolic acidosis, and they have elevated D-lactate levels. That doesn't mean much to most of us, but basically we've got an acid base. It's not, they're not right. And what happens is these kids are born normal at birth. They look normal. And I'll confess, of the goats I've raised and my dad, we never had it. But I've known people who have it and have had it, and I get a lot of questions, and I'm sure in some extreme cases it can be quite substantial. But they're normal at birth, and then when they're about 3 and 10 days of age is when they show symptoms. They're weak. They kind of look like the picture you see here, floppy. That's where it comes from. They're flaccid. They have no muscle tone. I actually I actually had a lamb this year that was born, I guess he was half floppy because his front was strong and normal, but he had no muscle tone in his back legs. Well, they have no muscle tone, period. They can't nurse. They're very weak. A lot of other things could come to mind. I know, like, for my lamb that had no muscle tone in the back, one of the first things I thought of was, well, was it white muscle disease, something like that? And so I treated him for it. Didn't do any good because that wasn't his problem. Like other things, finding it quickly, recognizing it quickly, and treating it. And the treatment is baking soda, oral bicarbonate. You're trying to correct that acid-base status in the kid. Again, it's a metabolic acidosis. Don't mix the baking soda in milk. You mix it in water. And the kid may also need some other supportive therapy like electrolytes. There was a recent study that came out that showed that when kids got better after you treated them, if you put them back with their mom, it might reoccur. And in this study, they actually put them on pasteurized milk because their theory is that this disease or syndrome is related to ingesting milk. And actually, like I said, there's a lot more they don't know about it than they do, other than to say it's a metabolic acidosis. I see we've got some good discussion on the pens for lambs. I know my jugs, I lay them in a hoop house. Both one end's completely open, the other end is partially open. My jugs don't have solid bottoms, they're all open. Okay, I didn't know where to put this topic, so I'm just going to kind of put it in the middle here, is cross-fostering or grafting babies. When a female doesn't have enough milk or one dies, ideally you'd like to give it to another one as opposed to raising it on a bottle. And these are just some different ways that you can do it. A slime graft would be basically you'd have to, the ewe that you want to, or doe that you want to give the baby to would kind of have to be lambing or kidding, and then you kind of take those birth fluids and put it on another baby to get her to take it. There's various, this is kind of like trying to get a ewe or doe to accept a baby that she's rejected. Same philosophy. Maybe there's no difference at all when you think about it. Trying to mask the odor. Another common method has always been, again, it's got to be about the same time she's landing or kidding, and then you skin the dead lamb and put it on her dead lamb and put it on the baby you want to graft, and then a stanchion like you see in this picture. This picture, in this case, she didn't like that little red one, and that was why she was in the stanchion. But the same philosophy would be for adopting a new baby. One of the best things is if you get a lot of variation, twins, singles, and triplets, you could actually, if you had enough animals, and this usually mostly works on big farms where you have enough animals having babies all the time that you can try to even out the milk supply. Okay, I want to talk a little bit about artificially raising babies. This is a perfect example of how you might end up with them. We got a doe with quads and we got a ewe with quads. And so there's various reasons why you may artificially rear these babies. You know, not enough milk for whatever reason. The dam dies, whatever. Large litters. The other reason you might do it that has nothing to do with their production per se is obviously if you're a dairy producer, you're going to wean, particularly dairy goats, you're going to wean them so that you can milk the dough. It's also the method that we use to control and get rid of CAE or OPP because, again, they're primarily passed through the colostrum. So you'd have to take the babies off and give them pasteurized colostrum and milk. Used to be that it was recommended, let's say you had a set of triplets and then the female, another female had just one and you wanted to give her one, well, who should you take off? They used to say you should take off the largest baby because the thought was that he'd have the best chance of thriving once you fostered him. Now the recommendation, and this is, even though they always had the old recommendation, this is the one I always followed, was I always took the smallest, weakest baby off. Because I figure if you've got babies doing well with their mom and you know, they're going to do well, you know, why risk them? So I would always take the smallest one off. And what I would, if I have to take one off, like if you saw the last picture of the ewe with quads, if I had to take one off, I'd still let them get their colostrum. You know, not do it for at least several hours. Make sure they get their colostrum. So just like the regular babies, they need their colostrum. When you are past the colostrum stage, ideally you want to feed a milk replacer that's specific to whether you're feeding a lamb or a kid. The big difference is sheep milk or ewe's milk has a lot higher fat than cow or goat's milk, and that's why you really should feed them lamb milk replacer. Will they do fine with goat and they do fine on cow's milk, but probably for optimal performance you want to make sure they have lamb milk replacer. You want to follow the directions for mixing it, feeding it, etc. After the first few days you don't really need to keep warming the milk. In fact, if you feed it cold, they won't, they'll have less of a tendency to overeat. If you got a lot of babies, you can put them on a self-feeder like you see here with these Sonnen dairy goat kids, or you can hand feed them with a bottle. Just like tubing, you need to make sure you keep everything clean. You want to start offering them solid food as soon as possible. I would often start them on just pure soybean meal because it's so very palatable. And you want to vaccinate earlier, 4 and 8 weeks of age. Not earlier than 4 weeks because, again, the vaccines are not going to be effective at those very young ages. You can wean them as early as 4 weeks. Should wean them by the time they're 8 weeks. I know some people will leave them on, particularly dairy goat folks. The main thing is that you should wean more on weight than on age. Common rules of thumb is that the baby weighs 20 pounds at least, 2.5 times its birth weight. You definitely want to make sure the baby's eating solid food, doing well, drinking water. Probably in the case of a lamb, if it's on creep feed, it should be eating about 1/2 pound a day. There's probably different opinions on this, but I always recommend weaning abruptly. You know, don't do it slow. Don't mix it with water. Just wean them abruptly. And after you've weaned them, keep them on that starter diet. Don't just throw them out on pasture or onto a lush pasture. And then there's cases when you would actually feed heat-treated or pasteurized colostrum or milk. Again, getting back to CAE, OPP, and then this kind of new theory on floppy kid syndrome. Basically, to feed them heat-treated, you want to heat it an hour at 130 to 135 degrees. Anything above 140 is going to destroy the antibodies. So that's basically pasteurizing it. I'm going to try not to spend too much time on these because I can see we're already past 8 o'clock. I just wanted to talk a little bit about the management practices that you may do with these young lambs and kids before they're 2 weeks of age. Ear tagging, weighing, docking, castrating, and disbudding. Everyone's not going to do them, nor should everyone do them. Some will do them all. It just depends. And what I wanted to do is to look at, well, why would you do it? There's clear reasons why you dock a sheep's tail. By docking, I don't mean removing it, I mean shortening it. That's what docking means. It means shortening the length of the tail. The primary reason is health and hygiene. So you don't get fly strike, you don't get flies laying eggs, maggots, that sort of thing. Hygiene, so they're cleaner. They're easier to shear, crutch. It's easier to see their udder. It's easier to assist them at lambing. Traditionally, it's been a preference of the market because that tail takes away from the carcass of that lamb. Dirty tails at slaughter aren't very desirable. Why might you not dock? Because of the type of sheep you have. You have hair sheep. I have Katahdins, I don't dock. You have a breed that has a short or rat tail, an East Frisian, a fin. There's no reason to dock them. If your production system minimizes dagginess, which is basically just a soiled rear end, poopy butt scouring, you might make a case for not docking. I think this would only work with short wool breeds. There's beginning to be more and more concerns about docking from an animal welfare standpoint. So it's often up there for discussion nowadays. The length of the tail is also an important welfare issue, but also an important management issue. This picture shows you where you should dock, at least from the standpoint of the U.S. recommendation, which is the distal end of the caudal tail fold. You can see it's the green, the one marked in green. In Europe, the recommendation is actually longer than that, so that the dock tail covers the ew's vulva and the ram's anus, or basically a similar length in the ram. Those are the basic recommendations. Show lambs tend to be docked shorter, and it's for reasons of appearance. But again, the recommendations that you see above are what you should do. Castrating, we remove the testicles or inhibit their function. How long do babies stay in the jug? That depends. They may never go in the jug. They may spend a half a day. Mine are in there probably about 3 days. If there's a problem, they might be in there longer. Think of it as isolation. You need to do it some for bonding, but you really don't want to keep her in there a long, long time. You want to mix her with other ewes and other females and other babies, but it does depend. It depends on when you have other space available, when you need another lambing jug, as well as how those babies are doing. If you've got them in a stanchion, obviously it's going to probably be longer. Getting back to castrating. Obviously, the reason we castrate is so we don't have rams breeding ewes, bucks breeding does when we don't want them to. Wethers are easier to handle. They make better pets, better animals for grazing. Traditionally, the market has preferred a wether. And some customers may still prefer a wether. You really should castrate if you're going to market older males. And it's a tradition. I'd be lying if I didn't say that was part of the reason we castrate, because we always have. Why shouldn't you castrate? Well, rams grow better. They have better carcasses in many respects, leaner, more muscular. The carcasses are bigger. If you're going to market them at a young age, you probably don't need to castrate. Young age meaning less than 6 months before they start to develop secondary sex characteristics, kind of at the beginning of puberty. There's also nowadays a market preference for an intact male among the ethnic markets. Again, there can be some discussions of animal welfare where castration is concerned. Here's the tools we use to dock and castrate. All of them work. All of them have pros and cons, and I just want to very briefly go through the pros and cons. First is an elastrator. This is by far the most common method in the U.S. used to dock and castrate. It's quick, it's easy, it's bloodless, the tool is cheap. It's painful, but not as painful as using a knife. You do have an increased risk of tetanus because you're creating a anaerobic environment under that band. No air, no oxygen. And Mary O gave another good reason why we castrate, and that's for show purposes. You can't show a ram lamb in the market lamb competition. You can't show a buck kid in the market lamb competition. Basically, the band cuts off the blood supply to the tail of the testicles. It should be applied between 1 and 7 days of age. Don't do it the first day. They're still bonding. 1 to 7. Do it in the first week. Definitely do it before they're 6 weeks of age. All these practices should be done as early as possible. How can you reduce pain? A couple of ways you can reduce pain. Not all of them are practical. You could give a local anesthetic, such as lidocaine. Our University of Maryland does that. You could combine the use of the band with the Burdizzo, which is the clamp, and we'll talk about that. And you could also make a short scrotum male. What that means is you push the testicles up into the body cavity, put the band around the scrotum will fall off, the testicles will still up inside. It's less painful and gives you a lot of the same advantages of having a wether, kind of intermediate between a ram and a wether. The Burdizzo is the picture you see there. It's a clamp. It has no cutting mechanism. It simply has a clamp. It's used to crush the spermatic cords. There's 2 of them. It stops blood supply, causes the testicles kind of to atrophy. They never fall off like they do with banding. They just have a little teeny sac. As mentioned, you can use it with the elastrator when you're docking and castrating to minimize the pain of the bands. If you're using a Burdizo, you want to definitely make sure you use the smaller one. You can do older babies. If I did ones that were a few weeks old, that might be the better method to do, and it is probably the least painful way to castrate and one of the lesser painful ways, again, if you combine it with the elastrator. It's less reliable. It requires more skill. People miss castrating. They miss it. And of course, the tool's more expensive. An emasculator is similar to the Burdizo, except it has both a cutting and crushing mechanism. Again, you can do a little bit older lamb. It's when the cutting and clamping are combined, it is less painful than, say, it's strictly the knife. It's, again, less reliable, requires more skill, and is a more expensive tool. But it's crushing. By crushing, it prevents kind of the hemorrhaging, so it crushes and cuts. Surgical castration, and by this we mean we're cutting them open. We may use just a knife. We may use a knife and a scalpel. We may use that tool called an all-in-one, which allows us to both cut and pull. Inexpensive, traditional method. You also, if any of you have ever seen that, heard of that Dirty Jobs TV show, this is probably the method that they demonstrated, where they cut the bottom of the sac off and then pull the testicles out with their teeth. Most people would use their fingers and pull them down away from the body until the cords broke, but the Dirty Jobs, I think, probably show the teeth. You don't want to actually cut the cords. You want to kind of scrape if they don't come out. It should be done on young animals only, and you need to be you need to use very good techniques in terms of an antiseptic and a wound dressing to make sure you don't have problems. I'll address those questions in just a second. The cons of surgical castration is it's bloody. It's open surgery. Has the greatest potential for infection and fly infestation, and is most definitely the most painful method of castration. How do we know what's painful? Usually what they do is they measure the cortisol in the blood. More cortisol, more pain. They also look at behavioral changes. Probably banding has the most behavioral changes. It's the most reliable method of castration because you count 1, 2 testicles hitting the ground or in your hand. That's why it's reliable. A lot of people concerned with animal welfare do not even recommend this method. If market is 8 months, do we still need to castrate? I think your market will tell you that. Traditionally, it used to be said that a ram lamb, if you marketed it before July 1, you would not be discounted. Much has changed over the last few decades, particularly in the eastern part of the United States where it's almost all ethnic market. If your market does not discriminate against ram lambs and buck kids, I guarantee they don't discriminate against buck kids, and you're able to separate them to prevent unwanted breeding and unwanted harassment of the females, then I wouldn't castrate. Heard that castrating can cause urinary problems later in goats because ureters stop growing. There's certainly some truth to it. It's kind of like neutering a cat young. It's a smaller opening. By the same token, you won't have urinary calculi problems if you feed them properly. Proper balance of calcium and phosphorus, plenty of water, and forage in the diet, you won't have that problem. What happens is we get people who don't feed them right. Say they have a pet goat, it's castrated young, they feed the goat grain, they just don't feed it properly. Okay? So I guess if you know you're not going to feed them properly, you don't want to castrate young. But if you don't castrate young, you should have a vet do it. Because if you castrate an animal that's a couple months old, from a welfare standpoint, you should not be doing that without having the animal anesthetized. Probably the most humane way of docking lambs is with the electric hot iron docker or electric docker. And some people will make homemade versions of this with hot irons and things like that. There's less chance of an infection with the electric docker. You can do older ones. And by older ones, I don't mean 6 months old. You should never dock and castrate animals that are 6 months old. Again, unless you work through a veterinarian. Even then, I would question why you're even doing it. Negative, electricity. That's not a real negative. I guess it could be if you're somewhere in the middle of nowhere. It certainly requires more physical effort, and it is the most expensive tool. But it cuts and cauterizes the tail. It smells like a tail barbecue when you're doing it. You tend to do a whole bunch of lambs at once versus banding. You can do them kind of one-on-one. But a really, really good tool. And like I said, probably the most humane method if that's important to you. The last thing, very briefly, you want to discuss about is disbudding. This is kind of a really interesting contrast of whether you do it or not. And I think probably the first thing I wrote up there on both sides is is really what it gets down to in some cases is personal preference. You either like goats with horns or you don't. Goats that are disbudded certainly are safer to be around if you're a person, safer to other animals. I still remember the time I had a buck cause an injury to one of my sheep. He gouged him in the side. From a management standpoint, disbudded animals don't get their heads stuck in feeders or fencing. I think they're easier to handle, but I know not all goat owners believe that. If you've got goats in close confinement, which would be typical of dairy goats, you tend not to want the horns. And then just like the castration requirement for show animals, if you want to show a dairy goat, they have to be disbudded. There's still some shows that still require market goats to be disbudded. We only got our county to change just this year. I don't know people with Angora goats don't tend to disbud. Because the reasons you don't disbud, one of the things is this really is considered a natural part of the goat, particularly an Angora goat, but also a boar goat. It's part of, it's part of being a male. They use them as weapons. I say they use them more as weapons against other goats. To me, a dog is still, or a predator is still going to kill them with or without horns. A lot of people like them for handling. They consider them like handles. Again, that's not my preference, but I know people do like them that way. If you're not going to handle goats a lot, like Angora goats out west don't get handled frequently. A lot of meat goats are out and about and don't get handled like a dairy goat does, so there isn't a need to disbud them. And for those of you who don't know, the goats can be naturally polled, but that trait is linked to infertility in goats. If you breed two polled goats to each other, you could get a hermaphrodite, which is an animal that has both sexual organs in it. So it's okay to have one polled goat, but the other one should be naturally horned. He can be disbudded, but he needs to be genetically horned. And disbudding, I'm not talking about dehorning, I'm talking about disbudding, which is preventing the horns from growing. Horns grow differently in different sex goats and different breeds of goats. It's usually somewhere between 1 and 3 weeks of age when the horn just starts breaking through the skin. Usually we put them in a box so that we can hold them. You still should have 2 people around to do the task. You have a disbudding iron as shown in the picture, and ideally you should clip around that horn area, but I know not everybody does. Ideally, you should numb the region around the horn area. That would require a veterinarian, so again, I understand not everybody's going to do that. And then you're just pressing that disbudding iron into over both of those horn buds. How long you keep it on depends. Depends on whether you've clipped it, things like that. And then you kind of turn it or twist it, and you'll get this kind of copper ring around it, around the horn bud. And you feel like you're doing, for those of you who've ever done it, I'm sure you feel the same way. You almost feel like you're doing a nasty thing, but my experience is when you're done and you put the little goat back down, he acts fine, And obviously there's a risk of holding it on too long, but and anyone that's new to goats should never do it themselves. They should they should learn how to do it from an experienced producer, and the dairy goat people have done it more than everybody, so they're a good resource, or going to a veterinarian. But I know myself, one year I was late on disbudding, so I took the goats to the vet to have them dehorned. Well, from a welfare standpoint, I thought disbudding was so much better than dehorning, even though the veterinarian didn't anesthetize them. They literally yanked the horns out of the head, whereas disbudding, while initially it doesn't look so, it looks, it does kind of looks mean, it really isn't, I don't think. All of these procedures obviously cause pain to the animal, and the question is simply, and I have firmly believed if we do our best to minimize the pain and distress for the greater good and health of the animal, I think that's what matters most. And I apologize for exceeding our time a little bit more today than previously. Again, this is a rather large topic that could include a lot of things. I was just trying to hit some of the highlights in terms of the causes of death and talk a little bit about the orphans and a little bit about the practices that we do. You know, talking about the practices that we just talked about, this obviously is a picture of one of my lambs. I ear tag them and weigh them and don't do anything else to them. I don't dock them because they're hair sheep. I don't castrate them because there's no reason in my marketing system. And I'm trying to think, obviously we don't disbud. I was disbudding my goats. I mixed. This one thing I'll say about, I recently read a paper on goat behavior. It was fascinating because they're so different from sheep. And one of the recommendations from a welfare standpoint was not to mix horned and disbudded or polled goats. And when I had the goats with my sheep, I believed in that, and I disbudded my nannies, and I didn't want them having horns mixed with the sheep. But I also believe the same thing with goats. Ideally, from a welfare standpoint, you would not mix horned animals, horned goats with polled animals or disbudded animals. They know it's a weapon. They know it's a weapon. And goats are far more domineering than sheep are. It might be all right to mix sheep with different horn status,